I am here with an interesting case for you all. A story that teaches us how anticoagulant therapy during pregnancy can impact both mother and baby. Meet Anjali, a 26-year-old woman who was overjoyed to discover she was pregnant. But little did she know, the medicine she had been taking to protect her own heart could put her unborn child at serious risk. 26 was ecstatic to discover she was pregnant. She had always considered herself healthy, except for a mechanical mitral valve replacement she had forgotten to mention to her new doctor. She hadn't realized that her lifelong warfarin therapy was crucial to keep her heart safe. Anjali's joy turned into a silent threat. She continued taking warfarin daily, unaware that it could cross the placenta. Weeks passed. She had no idea that the tiny life inside her was at risk of warfarin embryopathy. At her 12-week scan, the doctor noticed abnormalities: a small, underdeveloped nose, stippled bones, and other signs of warfarin embryopathy. Anjali felt her world shatter. She hadn't known. She hadn't been warned. She hadn't switched to safer anticoagulants like heparin or LMWH. Worse, her INR had fluctuated dangerously. Without monitoring, she risked valve thrombosis herself. Her heart, which had protected her for years, was now vulnerable too. Anjali gave birth prematurely. The baby had multiple complications and required intensive care, and her own heart needed urgent attention. A painful reminder that unaware anticoagulant therapy can endanger both lives. This tragic story is a warning. Every woman with a mechanical valve or anticoagulant therapy must inform their doctor before conception, monitor medication carefully, and follow a structured regimen. 2 hearts depend on it. Anticoagulants in pregnancy. Awareness is life-saving. Delay can cost 2 hearts. The story is over, and here's a high-yield takeaway message on anticoagulation in pregnancy: mechanical prosthetic valve. What mistakes did Anjali make, and what were the consequences she had to face? Mistakes Anjali made in the story: didn't inform her doctor about her mechanical heart valve. Her new doctor was unaware she had a mechanical mitral valve, which requires lifelong anticoagulation. This omission led to poor management during pregnancy. Continued taking warfarin during early pregnancy. Warfarin crosses the placenta and can cause warfarin embryopathy, Contradi syndrome, especially between 6 to 12 weeks of gestation. It leads to nasal hypoplasia, chondrodysplasia punctata, and midline facial defects in the baby. Didn't monitor her INR regularly. INR fluctuations can cause valve thrombosis if too low or bleeding if too high. Regular INR checks are critical in patients on warfarin. Lack of preconception counseling. She became pregnant without consulting a cardiologist or obstetrician beforehand. Women with mechanical valves need a planned pregnancy with anticoagulant adjustment. Now, let's learn how to manage anticoagulants during pregnancy. Baseline warfarin dose 5 mg per day. Continue warfarin therapy. Closely monitor INR 5 mg per day. First trimester, convert to LMWH-UFH. Second and third trimesters, convert back to warfarin. At 36 weeks of gestation, convert to LMWH-UFH. Vaginal delivery, continue UFH-LMWH until 4-6 hours before delivery. Cesarean section, discontinue anticoagulation before surgery. Reinitiate, LMWH-UFH plus warfarin. Once INR 2.53, stop LMWH-UFH. Hope you found this case helpful. Stay tuned with MedHouse for more such interesting clinical cases. Don't forget to like, share, and subscribe.